Critical stresses and strains of heart valves undergoing calcification, presented by
Brian Ho,
Ethan Chung,
and Victoria Shen.
Starting off with the important question, what exactly is calcification? Well, looking at the official medical definition of calcification, it's considered the process in which calcium salt deposits are left in a section of body tissue, as seen in the picture depicted below. And this ends up causing the hardening of and increasing the intensity of stresses and strains exhibited in a certain area. One of the most common types of calcification is actually coronary artery calcification, otherwise known as CAC. But now that begs the question, why just focus on CAC? We wanted to focus exclusively on CAC for several reasons. First, based on recent medical censuses and studies back in 2015 and 2016, CAC was identified to be affecting the majority of heart patients older than the age of 70, 90% for males and 67% for females. This while also being considered a serious ailment, having proven to have a strong correlation with several chronic heart diseases and even higher rates of cardiac arrest. Finally, and most shockingly, as the lack of research publications have shown, there is actually no real treatment for this condition yet. Therefore, our objective is to create a mathematical model of a heart under different conditions, such as healthy or undergoing early stages of coronary artery calcification, in order for it to possibly be used as a diagnostic tool.
Our research design and methods depended on finding the shear stresses and strains as well as the normal stresses and strains within the cusps of the heart valve. Key equations included Q cusp of X for finding the normal stresses based on pure bending, as well as tau, which was a function of the angle as visualized on ultrasound for finding the shear stresses. The first bullet point shows equations for shear stress due to viscous flow. The second bullet point shows an equation for delta P over delta X, which is the pressure gradient across the length of the valve, as related to volumetric flow rate, which we derived in a previous section. Bullet point 3 combines the previous two to yield tau, a function of X which allows us to find shear stress at any point X along the length of the cusp.
The heart valve can be a very complex structure, so we made several assumptions to simplify it. The slide here shows how the valve is converted from a 3D representation gradually into an ideal model for the pure bending. In the bending analysis, step 1, we draw a free body diagram and use the equilibrium to get external forces and moments. Then, by fictitious cut, as was taught in class, we get the internal moment MCZ, which is an essential part to get a normal stress. According to the equation, we will also need to know the IZZ. So, based on the previous assumptions, we made reasonable simplification on the shape of the heart valve as shown in the slides. If you look at the third picture in the slides on second moment of area, its cross-section can be a combination of two circles and a rectangle, in which case the IZZ is easy to calculate. So eventually we can get the normal stress of a heart valve by integrating these equations. If the heart valve is undergoing calcification, changes can be found in QX and IZZ, which will eventually result in a significant change in the normal stress.
Our results produced a model for heart valve stresses in stenosis patients, which also works for healthy hearts. It works using relatively inexpensive and non-invasive measurements, which can be done quickly and easily. It gives us both normal and shear stresses within the heart and can be used as a potential diagnostic tool.
With all the equations determined, we can conclude that we successfully created a mathematical model that can actually help us determine the maximum normal and shear stresses of a heart under several different types of conditions. Furthermore, we hope that the impact of this research could allow medical professionals to better understand the forces and strains behind straining heart conditions in relation to calcification, and therefore possibly take the first steps towards finding a real treatment, which was our objective all along. Thank you for listening to our presentation. Depicted above me is a list of our references that we used to help in our research for this presentation. Thank you.